Hi everyone, welcome once again. I would like to say thank you to all our subscribers. In today's video, we'll be looking at the planning station, which is a silent station. It is 14 minutes, and in this station, you have to come up with 2 nursing diagnoses from your patient. And these nursing problems could either be from the scenario or from your conversation with your patient during the assessment station. Yeah, so there's a video on homelessness. You can just watch that on our YouTube channel. So to say, this is a continuation, because after your assessment station, the next station will be the planning station. So it's a scenario on homelessness, like I said, and it's about a patient named Cheryl. So I've come up with 2 nursing problems for this patient. So the first nursing problem is that Cheryl is having infected wound. Before I continue, in your planning station, your 2 nursing problems must be related to that scenario. Okay, and we always advise that you pick on the first one that is most related to that scenario before you go on to the second one. Okay, so I said Cheryl is having infected wound. That is a nursing problem, and our aim of care is to promote Cheryl's wound healing. Yes, it's that simple. And the next one is our re-evaluation date. So now your re-evaluation date has nothing to do with your frequency of monitoring that you got from your assessment station. Your re-evaluation date is when you feel that you need to re-evaluate that patient for that particular nursing problem. Okay, so our re-evaluation date is going to be today. That's the date of your exam, and because it is an infected wound, I'll say every 24 hours or sooner if clinical condition changes. Okay, and the next one is the nursing intervention. Now, for the nursing intervention, there's an acronym that we use, although it's not compulsory for you to use that acronym, but it just makes things easier for you, and it makes it easier for you to remember those points that you need to write. Now, for the nursing intervention part, you only need minimum of 5 points. Minimum. You could write as many as you wish, but it should not be less than 5 points. You have to write in bullet points and make sure that your writing is as clear as possible and as legible as possible. If you need to strike out anything, make it very clear. Okay, so like I said, I'll be using Emma Tari. So the first one is explain to Cheryl all her care plan and gain consent. The next one, which is M, is monitor Cheryl's full set of observation every 4 to 6 hourly and escalate as per news policy. So how did I get the 4 to 6 hourly? That's the frequency of monitoring that will go during our assessment station. And the next one, which is A, is assess Cheryl's wound for any sign of deterioration. Okay, and the next one is T, teach Cheryl to include fruits in her diet to promote wound healing. And the next one is A, administer Cheryl's prescribed medication and monitor for the side effects and effectiveness. After A, we have R, which is referral. So for every nursing problem that you come up with, there must be someone you want to refer that patient to. So for this infected wound, we are going to be referring Cheryl to TG viability team. So refer Cheryl to TG viability team for further management. And the next one is the I, instruct or educate Cheryl on the use of call bell when she needs help. And the last one is document all care given to Cheryl. And that is all. Yeah, that is all about the first nursing problem. Now, the second nursing problem I'll be talking about is Cheryl is at risk of self-harm. Of course, Cheryl got those wounds from self-harm, so she's still at risk of harming herself. So our nursing problem is Cheryl is at risk of self-harm, and the aim of care is to reduce Cheryl's risk for self-harm. We want to reduce that risk. Our re-evaluation date is Cheryl will be re-evaluated today. That's the date of your exam. every 4 hours or sooner if clinical condition changes. So your re-evaluation date must be something that is realistic, okay? And now, moving to the nursing intervention. The first E, we are still following a matter read. Explain to Cheryl all our care plan and gain consent. And for the M, monitor Cheryl's full set of observation every 4 to 6 hours and escalate as per news policy. The next one, which is A, is assess Cheryl for any attempt to harm herself by putting her on close observation. So Cheryl has to be on close observation so as to know when she's making an attempt to harm herself. And the next one is the T. What do you want to teach Cheryl? Teach and assist Cheryl in identifying thoughts and feelings that can lead her to wanting to harm herself. And the next one is A. Administer Cheryl's prescribed medication and monitor for side effects and effectiveness. And the R. Refer Cheryl to mental health team for further plan of care. For the I, instruct Cheryl on the use of cowbell when she needs help. Or you could also say you want to educate Cheryl on the need for her to express her feelings, okay, and make sure that you listen to whatever she's talking about, okay. So, and then the last one is document all care given to Cheryl, and that is the end of the planning station. So apart from this, it is important that you write your name, your signature, and your date. In fact, what we advise is as soon as you get your planning question paper, your answer booklet and your question paper, go ahead and put down your name, your signature, and your date so that you wouldn't forget that. So try to practice on your own. You can come up with other nursing problems. It depends on the scenario, but like I said, this is just a follow-up on the video on homelessness. Thank you so much for watching. See you some other time. Bye for now.